Welcome to this presentation. My name is Amber Walker, and I am really honored and excited to be here to share a little bit today about the intersection of a couple of topics that I'm passionate about, particularly CIRS, or chronic inflammatory response syndrome, that is often triggered by exposure to mold and water damaged buildings. And today I'm really going to talk about how that overlaps with COVID-19 or the coronavirus, and how it can also be impacted by kind of the long hauler syndrome that we're tending to see in patients, or that more extended illness from COVID, as well as some overlap with individuals who are also struggling with the vaccines. So I think that this is definitely a timely topic, and a topic that is gaining a little bit more traction in our functional and integrative wellness communities. And I think it's something that we're only going to continue to learn more about as more of the research comes out about these areas. But just a quick little bit about me. I'm a doctor of physical therapy, and I have some certifications in functional medicine and nutrition. And I have a holistic wellness practice. It's called Origin Wellness. It's based out of Colorado, but I do telehealth with clients all over the globe. And really my focus and kind of my specialty area in the business is working with patients who have chronic illness from things like mast cell activation syndrome, or MCAS. Dysautonomia, or POTS, is another specialty area. I also commonly work with patients who have hypermobility spectrum disorders, such as hypermobile EDS. I do often work with patients who are sick from mold, and that's a big passion of mine, partly because I've lived through it myself and have experienced firsthand what that can be like. And then I also tend to work with a lot of patients who have either had illness following COVID that hasn't resolved, or illness following a vaccine. I also have written a few books, teach some courses, and again, like I said, my own personal experience in this arena has really driven this passion. So I'm grateful to be here with you guys today to share this. And it seems like the more I learn about these topics, the more I realize how much we don't know. I think this is a very common theme as we start to dive into some of these root issue approaches for chronic illness. So here's my disclaimer, I suppose, that this presentation is certainly not super comprehensive. I've tried to keep it to a short, reasonable length as sort of an intro to the topic. There are a lot of great resources out there, and a lot of research coming out that I'm sure is going to shift how we view this overlap in the future. So the objectives today, I'd really like us to dive a little bit deeper into what is CIRS, or chronic inflammatory response syndrome, specifically CIRS from mold exposure, and how does that influence the development of COVID? How does COVID influence the development of CIRS? There seems to be a two-way potential connection there. So I want to expand on that. We're going to be talking a little bit about solutions for these patients too, in terms of how to help them find healing from this inflammation that can come from both conditions. So Dr. Richie Shoemaker, I think, is important to pause and talk about him anytime we're talking about mold. He is really kind of the pioneer of this whole topic, essentially. And back in the 90s, I think it was around 1996, 1997-ish, he discovered some biotoxins in the Chesapeake Bay. And he basically started to make these associations with his patients that he was seeing between this cyanobacteria and some of these different types of poisonings that can come from fish, and how that impacts our health and our nervous system, and also how there's an overlap with what comes out of water damaged buildings and the same kind of symptoms. And he's the one who discovered this visual contrast sensitivity testing. He started to make correlations and helped the field expand on knowledge about genetic connections between water damaged buildings and symptoms, and as well as blood markers that we can look for mold illness. He's the creator of something called Surviving Mold, which is a wonderful resource website. And he's also had some other publications out there on this topic. And he trains other practitioners in how to help with chronic inflammatory response syndrome. So he is really an important name to know. And what Dr. Shoemaker found is that a lot of different things can cause CIRS. Now, 70 to 80% of the time, CIRS is caused from water damaged buildings. So that's it's kind of most common cause, but CIRS can also be caused from things like Lyme disease, other vector-borne illness that often accompanies Lyme disease, like Bartonella, for example, or Babesia. Other bacterial infections can also trigger a state of CIRS. We know that venom from things like snakes or insects can trigger this type of response in the system as well. We're seeing more and more potential for viral infections to trigger CIRS. There's certainly the marine toxin infection that I discussed a moment ago that can have an influence and trigger this, even certain types of spider bites. And then traumatic brain injury also can trigger a CIRS state. So it's not just mold. The majority of these cases do have a connection back to water damaged buildings, but we do see a lot of other types of triggers contributing to this chronic inflammatory condition. There are a lot of different symptoms of CIRS, and this is not an all-inclusive slide by any means, but these are some of the common symptoms. Now, when people think about getting sick from mold, they often think about respiratory issues, asthma, maybe some sinus issues or nasal issues, but mold exposure can lead to a lot more kind of multi-system symptoms than simply the respiratory or the sinus area. So we tend to see brain fog is a big one. That's probably one of the biggest ones I see in my practice. Fatigue is often very severe with this, and that's a very common symptom. Headaches are very common. A lot of these patients are going to have skin issues, joint issues. Dizziness and or vertigo is also fairly common. Many patients find themselves just not feeling like themselves, or they feel moody or irritable, and have a hard time functioning with daily life, many of them to the point where they aren't able to work, and some are actually homebound and bedbound as well. There can be a lot of urinary symptoms when it comes to mold. I tend to see that quite often. Many of these patients develop sensitivities to a lot of chemicals and foods and other things in their environments. Many of them have abdominal issues as well, abdominal pain. Sometimes these are functional gastrointestinal diagnoses that are kind of co-occurring with the mold exposure. And sometimes they're sort of the irritable bowel syndrome label without really any idea of what's going on there. Patients will have neurological symptoms often. Frequent thirst and urination is pretty common as well. And I tend to see a lot of anxiety and depression, very, very common. Weight gain, occasionally the other end of the spectrum where people can't put on weight can also occur, but I would say more often we see, because of mold's affinity for fat tissues and being stored in the fatty tissues, we tend to see bigger issues with weight gain that tend to resolve once we start to bind and remove the mold toxins from the system. Insomnia is a really big one. I see, especially in patients who are actively exposed to mold, I see a lot of issues come up at night, worsening of symptoms, particularly if they're sleeping in a room that has a higher degree of mold in it. And we tend to see a lot of other systemic issues going on. Here are a couple other unique symptoms. Frequent static or electric shocks are pretty common in these patients. Many of them are also sensitive to EMFs, and so that can be an issue. Occasionally, I do see some seizures in patients who have been sick from mold, and some issues with things like healing of connective tissue wounds or bone fractures that can also be accompanied by this condition. And sometimes we do see symptoms worse in certain seasons. Symptoms might be worse in the winter, depending on where the patient lives, or on rainy days. Sometimes the spring after snow melt can be a big trigger for people. You can see there's a lot of unique symptoms here on this slide. However, these symptoms are common to a lot of chronic illness conditions. So how do we really differentiate based on symptoms? Well, Dr. Shoemaker put together this cluster of symptoms that kind of helps increase the likelihood, or I should say the index of suspicion of mold illness. So if we look at these clusters that are separated out, he found in his research that 6 or more symptom clusters. So if patients check off one of these boxes in 6 or more of the boxes, there's definitely a likelihood that mold could be impacting their symptoms. If they check off symptoms, not all of the symptoms again, but one symptom from each of the box would be a positive box. If they have 8 symptom clusters or more from these boxes, there's a very high likelihood that they do have CIRS going on. So this is a screening tool that's now coupled with the visual testing that we'll talk about in a moment that can help us kind of based on symptoms decide, are we barking up the right tree here? Should we consider this? Should we have mold illness on our radar? These are kind of the proposed guidelines for CIRS diagnosis. Now it's kind of, there's a lot of gray area here, and there's a couple different camps when it comes to mold and in terms of how to test for this as well as how to treat it. But in general, we're looking for some kind of a indicator of exposure. And that might have been exposure 20 years ago, 30 years ago. For a lot of these patients, they would say, oh yeah, when I was a kid, there was black mold growing all over the walls of the house I lived in. So it's not necessarily a recent exposure that necessitates kind of this decision making, but it could certainly be something that is more historical. A lot of times it's also from school. So it's not always the homes people lived in, but many kids are exposed to mold in the school environment, as well as the work environment needs to be considered. So typically we're looking for some kind of suspicion with either a musty odor that was in a building or an environment. Perhaps there was that visible mold that you could see with the naked eye. And also it's helpful to have some commercial testing that kind of confirms these suspicions, especially if it's suspected in the current residence. We're also looking for symptoms, as we just looked at on the last slides, similar to those seen in the published literature. We're looking for lab abnormalities as well when it comes to mold illness and the diagnosis of CIRS. And if we're following the Shoemaker protocol, there's going to be some blood markers, at least 3 elevated blood markers that will help kind of raise that index of suspicion that this is going on in a patient. If you aren't following the Shoemaker protocol, there are some other types of tests that we'll go over in a moment that can also help confirm suspicion of CIRS. And typically what we see in these patients is some kind of a response when they're out of the environment. So if they're currently exposed to mold, they might do a mold sabbatical where they're actually leaving the space and leaving exposure to the belongings as well. And typically there's some kind of a difference in symptoms after enough time being away from that environment. For others who have more of a historical mold exposure, we're also looking for a response to a binder. So if they start to bind mycotoxins and get them out of the system, do the symptoms improve? Again, this is not a perfect science here, but there's sort of an art to helping make this diagnosis and an art to treating it as well. Now, here are some of the tests that we use in the diagnosis of CIRS. Certainly start with symptom questionnaires to decide if this is something that is a potential possibility. Visual contrast sensitivity testing is an eye test that you can actually have the patient do on their own at home, where you calibrate the laptop or the computer you're using, get everything set up, and then test one eye at a time. And you're looking at the ability of the optic nerve to detect different shades of contrast with this test. It spits out a score, and it can help based on a couple of different columns in the test results. You can glean some information from it about whether or not mold is likely or CIRS is likely. Now, the visual test is not just specific to mold. I mentioned the other causes of CIRS when we started talking about this. And so again, this test is not diagnostic in itself, but it can help us get a baseline of measurements, and it can help us decide if we should, be concerned about CIRS. Now, occasionally, especially in my young patients, I tend to see negative visual contrast sensitivity tests, and a lot of these patients still have other lab markers showing that they do have CIRS from mold. So again, it doesn't necessarily rule it out, but it can help get some patient buy-in. It can help us track progress over time as well. I'll show an example of the visual test later on in this presentation. We have a lot of blood markers that are specific to CIRS. I'm not going to list them all here, but if you are working with a practitioner who is certified in the Shoemaker protocol, they will go into depth onto those blood markers and how we use them to determine if somebody might have CIRS, as well as to monitor treatment. There are some urine tests that can be helpful that actually look at mycotoxins that come in the urine. We have a couple of labs here that are kind of the highest regarded labs for this type of testing. We have Great Plains Lab, Real Time Laboratory, and Vibrant. And these tests all have their own, pros and cons and strengths and weaknesses. But the urine testing is, not something that's used by the Shoemaker protocol, but it is used by some of the more naturopathic or functional practitioners who are looking at mold. And in the majority of cases, we pick up on something in the urine. There is a small percentage of patients who are so sick from mold and literally their detox pathways are so clogged that they are not able to urinate out any of these indicators of mold. And so that can occur too. There can be a false negative rate on that urine testing. But as a whole, it usually picks up on something for most people. We have antibody tests for mold. There's all sorts of stuff out there. But I would say the ones that are highlighted here on the slide in bold are the ones that are kind of most commonly used for diagnosis. These other tests below talk about other things we can measure that can be really helpful too. They're not diagnostic for mold, but they might be some tests that practitioners will also order to help get an understanding of what's going on in the system. The organic acids test is one that I use and find very helpful with kind of putting all these puzzle pieces together. Some patients want to get some genetic testing done. And we do have some HLA-DR genetic pathways that can provide some insight into whether somebody is more likely to get sick from mold. What happens in the research estimates, around 25% of the population, possibly up to 50% in more recent studies, is that it appears that some humans don't have the ability to tag mycotoxins as harmful and excrete them and remove them from the system. So there's a subgroup of people who genetically don't have this ability and are more likely to have these mycotoxins build up in the system and make them sick. And this explains why some people are sick from mold and some people seem to be symptomless. So again, you can be in the same house with family members or in the same office with coworkers, and not everybody is going to have symptoms from the mold, at least not any extreme overt symptoms. So part of that does have to do with this HLA-DR gene, and basically that can be tested through laboratories. Again, that doesn't diagnose mold in this, but it can help show if somebody is more susceptible to that occurring. We have some brain imaging that also in recent years has shown us that mold impacts our nervous system and our brain tissue. And so there's neuroquant analysis, which Dr. Amen at the Amen Clinics has pioneered that field. And that's pretty impressive if you ever want to learn about it. But there's definitely some patterns you see in patients who have CIRS from mold that come up on those neuroquant scans. There's some other testing, including nasal swabs to look for staph infections in the nasal passages or other fungal issues. Candida testing in general can help raise the suspicion of mold, and candida and mold often go hand in hand. Candida is a type of fungus, but it often colonizes in the gastrointestinal tract and some of our other tissues. That can be a sign that somebody has a stubborn mold infection, and especially if candida isn't resolving with the conventional approaches, we often see that that's because the mold is present, and often candida won't go away until we address the mold. And then I mentioned earlier this mold sabbatical. Some practitioners will actually use that as part of their diagnostic criteria and have patients leave the building they're in if they're suspecting that they're currently exposed, to see if that helps confirm the suspicion. So there's been some interesting research that has come out in the last few years. As COVID has come onto the global scene, we've started to see some connections between mold and fungal infections and COVID. So I wanted to touch on a little bit of the research I was able to find out on this topic. Certainly not an all-inclusive review of the literature by any means. So what some of these studies have found, first of all, is that COVID-19 can create a state of immunosuppression. Specifically, we see lower CD4 and CD8 T cells in patients, and that can be part of the reason they acquire these hospital-based fungal infections, which often lead to death. So what I found, and I didn't realize this until I started researching this more, was that a lot of the times when people who are hospitalized, especially people who are on ventilators from COVID, when they end up passing away, it's not necessarily that they're passing away from the virus itself, but they actually might be passing away from a secondary infection, like a fungal infection. So essentially, COVID appears to kind of pave the way for a more likelihood of picking up on these other fungal infections that then lead to death. So we have a couple different types of fungal infections that we look at with the inpatient setting. Aspergillosis is the most common one. And then we also see mucormycosis. And both of these can be very inflammatory and also deadly. So we're seeing more and more of this come to light, this overlap between patients who are hospitalized from COVID and these fungal issues. And some of it does have to do with the ventilator equipment itself and how you're more likely to have exposure to mold through that equipment. Some of it also has to do with the ambient environment and actual mycotoxins that are in these hospital buildings, which is a whole nother conversation, really. So both scenarios are not good. We look at some of the research. For example, a study that came out of Chile in 2021 found that 11% of the patients that were hospitalized with COVID also had mold illness. And I think that might be an underestimate. Some further studies found higher rates than that, but there were basically 12 different types of mold that were found on testing. And a lot of these types of mold, like Fusarium, for example, are more environmental types of mold. We can get a little exposure from our food sources and our grains and different things, but based on the numbers coming out of these studies, this was definitely an environmental mold issue that was occurring. So again, more likely to happen in patients who are on ventilators in the hospital. And the other thing that these studies found was that these patients were rarely treated with antifungals. So if the mold infection was registered while somebody was in the ICU, often nothing happened. They weren't treated with antifungals. This potential root cause of a mold inflammatory issue going on alongside COVID wasn't often treated. And so that's also very concerning. Other research also focused on these T cells and this concept of immunosuppression, and looked at the conditions that tend to predispose these patients to different hospital-acquired infections, either bacterial or fungal in nature. And we know that patients who have diabetes are more at risk. Patients who are undergoing transplants, chemotherapy, et cetera, are more likely to be immunosuppressed and are more susceptible to having these long-term complications and potentially needing to be on a ventilator. This isn't a new topic though. So we're seeing trends that we've noted all the way back when SARS was a big deal. So back in kind of the early 2000s, as SARS was coming to light kind of on the global scale, we were seeing these fungal infections and taking note of them in research, especially in hospitalized patients, even back then. So fungal infections tend to be sort of opportunistic, and certainly patients who are immunosuppressed are more likely to develop them, especially in the hospital setting. What some of the research has also found is that there's a subgroup of patients who didn't have diabetes or immunosuppression. And in fact, a large percentage in one study, almost half of the patients that ended up having this hospitalization for COVID-19 and these fungal infections at the same time were young, and they didn't have a lot of these classic comorbidities. So that's also very concerning for us. If we're seeing that a healthier cohort, or people who feel that they're healthy prior to all of this, are, developing these fungal infections, it's definitely drawing a lot of attention. We are also seeing some interesting kind of side effects of this global pandemic in the sense of predisposing more mold growth and more mold exposure, both in food and buildings. So this study I thought was really fascinating, talked about how we're using these different disinfectant agents even on food packaging. So a lot of our products, you might not realize this, but a lot of the products that are packaged go through a sanitation process. Since the coronavirus started, there's been more of this process happening that involves water, that involves spraying down packaging with different things in efforts to reduce transmission of COVID. This was especially common the first, year or two of the pandemic. And so what we're seeing is that these food products that have been sprayed down are actually more likely to develop mold, and we're more likely to ingest mold in our food now than ever before because of this global pandemic. Another study found that a lot of the workspaces that were sort of vacant during the pandemic ended up having water leaks or damage that went unnoticed, and that there are a lot more moldy office spaces now than ever before because so many people were working from home for that time frame. So there's all sorts of implications from when we look at the environmental piece, and it looks like, there's several factors that can influence this. A lot of these buildings have poor ventilation. um, some of the ventilation systems just aren't functioning right or are dysfunctional. And this can happen in homes too. We see this a lot in bathrooms, or bathroom fans aren't working right, and that can really increase the risk for mold developing in homes. But we also see ventilation issues in these commercial spaces. And so what these researchers concluded after realizing how much more mold appears to be now in our working environments was that buildings really need to be tested, and they need to be tested the right way before we have this mass return of people to the workspace. So I thought that was a very interesting one. But really what happens here when we look at this concept of CIRS from mold exposure is that it's not just CIRS. It's often the perfect storm of a lot of different inflammatory issues going on that predispose us to getting CIRS, or if we already have CIRS, that we're more likely to acquire these other issues and inflammatory root causes here. And I think toxic burden is a big common factor, a big common denominator here. And we really need to have that on our radar, that exposure to toxins, whether that's mycotoxins from mold, whether that's chemicals, heavy metals, pesticides, toxins that we're exposed to in our skin, in the air we breathe, etc. All of this needs to be on our radar. But most of the patients we work with who end up getting CIRS from mold exposure, and potentially I could also argue who end up getting COVID, are going to have some of these underlying root issues going on, whether they're aware of them or not. And so it's really important that we work as integrative practitioners, that we're working on all of these different angles and trying to provide resources for these patients in regards to the root issues that we see with these labels and conditions here. There's a huge overlap with the nervous system. I see this a lot in patients who are both sick from mold and who have had COVID, or are COVID long haulers, so to speak. And we tend to see our cranial nerves being strongly impacted by these inflammatory conditions. It kind of turns into a vicious cycle when we have some nervous system dysregulation going on. So we have our vagus nerve here. That's the big nerve that goes from the brain all the way to the gut. And there's quite a lot out there on how important it is to address the vagus nerve in chronic illness. I think everybody who has COVID and or CIRS from mold exposure should have a comprehensive nervous system program set up and should be working on this. But we see here that a lot of these cranial nerves exit the skull and have close proximity to one another. And so we just tend to see a lot of overlap between patients, for example, who have kind of neck tension, head and neck issues, digestive issues, sensory overstimulation. Some of that can come from the vagus nerve, swallowing issues. There's a lot of overlap in terms of some of these long-term symptoms that people are reporting after having COVID. And some of it could be a direct relation to mycotoxins themselves in the system and or viral particles. But I think some of it also has to do with what's going on with our cranial nerves. And so it's important to have this on the radar and to do some work to help patients recognize where their nervous system is at. A lot of times these patients who have chronic conditions, they might go into fight or flight, but for many of them, they actually drop into, that dorsal vagal pathway of freeze. And that can be really detrimental to healing. And so I feel it's very important that we have this on our radar as practitioners, and that if we're not trained ourselves in how to help with some of the nervous system approaches, then I think we need to be referring our patients out to get this kind of care. So these are some of the areas I think are really important to address for these patients who have this history of COVID and or mold exposure. I think we need to be looking at internal health stressors. Now, internal health stressors, that's kind of a category I coined for things that impact the body, things like chronic viral infections, bacterial issues, things like SIBO, leaky gut, some of these things that impact us from the inside out, essentially. This might be hormonal imbalances or adrenal issues, all sorts of things that we, as functional medicine practitioners, have on our radar for internal health stressors. It's really important to address those. External health stressors might be things that more kind of attack our system from the outside in. So this could be exposure to some of the toxins we talked about that can definitely impact our system. Also things that impact us, globally from an external standpoint could be even things like EMFs. So exposure to electric and magnetic fields can definitely play a role as well. Toxic burden is really important, and many of these patients have sluggish detox pathways and need a lot of support in this area before we can do any treatment of the mold. That has to be there first. Nutritional deficits, many of these patients are restricted in what they can eat or have reactions to foods, but it's really important that we have a customized approach there, and approach that focuses on a low toxin diet and getting lots of healing nutrients in is really important. We just touched on the autonomic nervous system dysfunction on that nervous system slide, but I think this is really important, potentially contributing factor to what's going on in these patients that needs to be addressed. Many of these patients also have, needs in the sense of inflammation that's occurring on a structural or a musculoskeletal level. So a lot of these patients are having chronic inflammation in joints or connective tissue. I see a lot going on with the head and neck and the spine. Very, very common in patients who are sick from mold and who have had COVID. So we want to make sure that's on our radar and that we're addressing that as well. And I think a lot of these patients are also deconditioned, or in some cases they're doing too much and they're taxing their system too much on the exercise angle here. But I think that many of these patients are so fatigued and are often homebound when they reach a certain point, and they're not getting that motion and that movement they need to help heal. So I think all of the above needs to be addressed, whether we're talking about just mold, just COVID, or COVID and molds coexisting. So here's kind of a practical toolbox for post-acute sequelae of COVID or COVID long haulers. Again, getting to these root issues is so important. And we just talked about basically all of these topics on the last page. But I think one thing we can also expand on here is just the importance of limbic retraining, tools for trauma. Again, lots of referrals here, making sure patients get the help they need and are able to address the history of trauma that as humans, most of us end up having by the time we're adults. So all really important angles here. That mental, spiritual, emotional healing is very, very important here too. I wanted to talk about a patient that I have seen, kind of a little case study that kind of puts all these dots together. I had a 37-year-old male patient who I saw about 10 times over a period of 13 months. And he was originally seeking care for COVID long hauler concerns. So he had had COVID about 9 months prior to when I worked with him. He was recently diagnosed with mast cell activation syndrome and POTS. He had a lot of symptoms going on. He felt this tightness in his abdomen and chest. He also reported that he was really hoarse. He had a lot of fatigue. His heart rate was all over the map. So he had a really unstable heart rate. He was having some orthostatic hypotension going on, had a high degree of anxiety. He also did have some PTSD from having had COVID and was really, to be honest, quite terrified to leave the house again. Now, this was, still within the first year of the pandemic, and there was still a lot more going on for lockdowns. Vaccines were just kind of starting to come out. And so he really was afraid to even walk to the mailbox for fear of getting COVID again. He was bedbound. He had left his job. He was noticing a lot of swallowing issues. He was having issues tolerating foods. He was also having these scary episodes where he would wake up in the middle of the night just gasping for air. He was having insomnia. He was having a lot of symptoms at night. He'd seen a ton of different specialists so far, and really they'd picked up on a couple of things, but nothing that seemed to make sense for kind of the breadth of his symptoms. So they figured out that he had a little bit of hypothyroidism going on. They did some testing for cortisol and adrenal function, didn't find much going on there. They ruled out Lyme disease with him. They did a lot of mainstream testing for his lungs and his heart, and really just didn't find anything there with the testing. So he'd gone through and spent a lot of money and seen a lot of specialists and really wasn't finding anything that was helpful for treatment. What he did tell me in his history, which kind of clued me into the mold piece, was that right when he got COVID, he was exercising really heavily in this moldy basement. He had been down there for about a week. He got some new gym equipment and put it down there, and he started using it. And that's right when he got COVID. And so we ended up running some functional tests and found that mold was indeed playing a role here. I had him do the visual contrast sensitivity test, and this is what the report looks like. So we have this gray bar, which is kind of the age-matched healthy norms here for each eye. And that's what we tend to want people to be around with the visual testing. We want people to, the red line, to be at or above the gray line to be a quote normal test. The first two columns here, A and B, are more indicators of nutritional status. And you can see that for both eyes, it appears that he's having some nutritional deficits and some things going on in the gut. These blue columns, we look at mold a little bit more specifically, or I should say the likelihood of having CIRS, not just mold, but CIRS, which can be caused by several different things. And we see that his left eye actually performed pretty good. He was at the gray line or above it there. So that's a negative finding there. His right eye didn't do quite as well. His right eye was a little bit lower there. And it's really common to see one eye stronger than the other on this test. And then we look at this column here, column E. He's actually above the gray line on both of those two column E spots. So, just looking at this test alone, his percentages are definitely not the worst I've ever seen. Often a lot of moldy patients are in the 40, 50, 60th percentile on this test, but it wasn't a clean bill of health either. So he decided he wanted to do the urine test. He did the test through real-time laboratory here, which basically came out with the findings that basically these 5 categories of mold that it looked at, they were all positive for him. He was in the red zone for all 5 types of mold tested. So this did confirm that we needed to do some work on mold and that he was likely experiencing CIRS from mold exposure. We did some other tests. We looked at functional stool testing. We saw dysbiotic Klebsiella. We saw Clostridia as well, which can be a big trigger of a lot of neurocognitive issues. We saw Candida as well in that test. And so we had several things to kind of address from a functional lens. Luckily, this guy was able to move into a new home within a few months, which was really helpful for him. That's probably the biggest barrier with these patients, is that it's really hard for them to get into safe housing or mold-free housing. And that can take a long time, months, if not years, if patients are also going to remediate. And unfortunately, it's easy to move into another moldy building. So there's a lot of caution and a lot of specific things that need to be kept in mind when looking for mold-free housing, and can be a challenging road. It's also challenging in the sense of what to do with belongings. And there's a lot of different expert opinions on whether you need to get rid of all your belongings or not, or what can be cleaned and what can't when it comes to mold. So again, this is not an easy thing to go through for patients and the families, but it's something that's so important. The first thing that all the experts agree on with treatment is removal from exposure must happen. That's the first thing before we can start to really bind these mycotoxins and get them out of the system. Now, most practitioners have a several step process for treating mold. Again, this is not the Shoemaker protocol that I'm following here. So if you're interested in that, I highly recommend you look at some other resources for that, because that can be a very effective way to treat mold. But kind of the other approach, kind of the more naturopathic approach for treating mold, we typically start with removal from the environment. We then get into some ways to support the detoxification pathways first before binding. And that's really important. You can't just throw a binder at these patients and hope for the best. You really have to make sure that their system is ready for that, and that you're binding at the right frequency, the right dosage. Less is more, and you have to go very gently with these patients. So essentially, I guided this patient through that process. And he started to feel quite a bit better once he started a binder. He was able to start to bring in other foods and nutrients. His swallowing started to improve. He was on a very clean, whole food, plant-based diet, which helped. So he was already on board with a lot of these holistic practices. He was also doing a lot of work on stress management. We started to get into resources for him for trauma. All of this was very helpful. We also did address some of those root issues in the gut. And so, the Clostridia was important to address. We addressed Candida eventually down the road, but addressing Candida infections at the same time as addressing mycotoxins with a binder can be really tricky. And often it's too taxing on the system. So you really have to go kind of in a slow, stepwise approach here. But over several months, we were able to do the binding. We did more nervous system work, which I think was also helpful. He did the Safe and Sound protocol, which is an auditory therapy for the nervous system. We started to work more on desensitizing him to being in public again, which I think was really important. And a lot of practitioners just don't have the time to go into these areas. But, over the course of time, we were able to get him going to the mailbox and back, just kind of getting comfortable with being outside of the front door first. And then eventually he started doing, some trips around the block. Eventually he started walking on the bike path where other people were going by. And so we slowly got him to reintegrate back into the community while grounding the nervous system and giving the nervous system signals that it was safe at the same time. And this isn't something you can just tell someone to do. You really have to work carefully with somebody when it comes to the autonomic nervous system to help coach them through that process. A lot of trial and error and a lot of breath work, meditation. Some of these modalities that can be helpful for the nervous system can actually be triggering for these patients if they're not gone about the right way, or if these patients have a history of severe trauma. It really needs to be a customized approach, and not every exercise out there that in theory should help the nervous system is going to be helpful. So coming up with a customized toolbox is very helpful for these patients with that nervous system work. We did some work on other areas, such as reducing exposure to EMFs, for example, started to get him moving and exercising again in a gentle way at first. And again, working on that mental, spiritual health with the help of some referrals, addressing trauma, that was really big key here. Eventually, we were at the point where we could do the nasal treatment of mold. So it's also important for a lot of these patients to address these intranasal and kind of sinus area colonies of mold that can occur. So after you do the binding, often there's a phase where we are focusing a little bit more on nasal sprays. In this case, we used an herbal approach for that, and that was successful for him and helped to reduce symptoms further. And then we were able to get in and do a little bit more work on the Candida piece. Once we had reduced that total mold kind of level and burden in his system, we were able to do more work on Candida. So at that point, he was doing pretty well. He did have a couple of symptoms remaining. He had some fatigue that got a lot better after we treated Candida. He was still having some swallowing issues and some issues with foods, not so much sensitive to foods, but more just having trouble swallowing and getting certain textures down. And then we did get into a little bit more of the structural piece, and we recognized that this client also had craniocervical instability going on. He had a lot of things going on at the head and neck. He had a little bit of Chiari malformation going on, and so that was impacting his swallowing. And so we really started to shift our focus to more of the structural piece, which was also very helpful for him. So again, in this case, we kind of went through all the angles. We worked at those internal health stressors, some of the things that were impacting his gut in particular, the external health stressors like the mold piece, the EMFs. We worked on the toxic burden in general and his lifestyle and detoxification issues, worked on nutrition. The autonomic nervous system piece was really huge for helping him heal from both, I think, COVID and CIRS from mold, and then got him back into some more meaningful movement and exercise, and helped sort of desensitize his system from some of that trauma he had been through surrounding COVID itself. And so helped him reintegrate back into the community. Eventually, he was able to return to work full-time at the school that he was teaching at, and he was also able to resume weightlifting and a bunch of other types of exercise that he had previously enjoyed. I mean, this whole process took just about a year from start to finish. So it's not quick. So that's important to educate patients that we have to go slowly and gently with the system and working in all of these angles. But I think that we see a couple of things come up when we talk about these patients. We see in the intersection of mold and COVID that COVID predisposes people to be more likely to develop these fungal or mold infections in the system. So COVID can kind of create a more immunocompromised state in these patients. But I also think that having a background of mold exposure and having this inflammation going on under the system, kind of under the hood there, predisposes people not only to getting COVID, but to having more severe cases of COVID. So I think it's a bidirectional issue that's going on here. Most of the research, as you saw, is focusing on when somebody already has COVID, are they more likely to get a mold issue? But I really think that we need to start putting more feelers out there on this theory that having CIRS already in the system or having this history of mold exposure, whether it's recognized or not, can really predispose people to having other chronic viral issues come up. Now, this isn't the first connection we see with viruses and mold, or viruses and some of these other common functional medicine root issues. We look at Epstein-Barr virus and some of these other chronic viral infections, and we know that these can cause long-term symptoms in people, and it can be sort of a slippery slope where they are more likely to develop gut issues and other things that go on alongside it. So again, this isn't new, but I think it's new from a mainstream lens, and it's new from kind of a general population awareness. And so my goal here is to share the importance of prevention. At the end of the day, we have kind of this concept above the iceberg here. The mainstream approach is very medication focused. It's not a very preventative approach. I think we need to be working on all of these things under the surface here, a functional root issue approach, like we talked about with that case, kind of putting all these puzzle pieces together to really help these patients. It's not just taking a binder for mold or just looking at candida, but we really need to dive deeper and help these patients navigate all of these topics and make sure that they have good social support and community. That's also really important, or connect them with the right resources to help them heal from trauma. At the end of the day, though, prevention is key. It's all about prevention. So I think what's, we're running into in these hospitals is that we're catching people when they're almost too far gone. So people are so inflamed from COVID, then they also get a fungal infection, and it's really hard for the system to come out of that. If we can work on prevention in the first place and help remove these kind of toxic influences, such as the exposure to mycotoxins, for example, if we can help patients kind of clear out the junk, open up these detox pathways, reduce these root issues, improve gut health, et cetera, I think that people are going to be way less likely to get COVID in the sense of a long hauler scenario. So I think people are going to heal better from chronic viral infections such as COVID, and they're going to be way less likely to be hospitalized in the first place, way less likely to be needed to be put on a ventilator, and way less likely to have these long-term complications. Prevention is key. Prevention is everything. And I know that we want in culture often a quick fix. We want a Band-Aid, a shot, something to help life go back to normal, but we also need to be putting in the work, looking at how much sleep we're getting, how are we managing stress, what is our nutrition looking like? All of these factors are so important for our immune system and our health in general. And we really need to start there and, make a big cultural shift, I think, to help reduce this. I think we also need to just be aware of how prevalent mold is, and water damaged buildings are extremely, extremely common. And, most buildings at some point in their life are going to have a water damage issue. I think at least 50% of the homes at any given time have something going on in terms of water damage. So it's extremely, extremely common. I think a lot of our chronic inflammatory issues like asthma, for example, people who have chronic headaches, we need to be looking for these things. And there's a very good chance that there is some kind of a connection to mold with these patients and beyond. So I hope that you have learned something from this presentation. Kind of to summarize what we talked about, there's obviously a lot of overlap between post-acute sequelae of COVID or long haulers COVID and this chronic inflammatory response syndrome that comes from mold exposure. They coexist often. I believe they have a symbiotic relationship that fuels inflammation. And the chicken or the egg question, well, did they have mold first, like the case I shared, and then they got COVID? Very, very possible, very likely. Did they have COVID first that predisposed their system to develop a fungal infection? Also very likely, especially in hospitalized patients. So we kind of see this bidirectional influence there. It can definitely work both ways. And I think both things need to be addressed for these patients. I think we need to shift to a preventative level in the community and start spreading more awareness of the impacts of water damage building and the impacts of mold. We need a huge shift in the industry because there's a lot of improper advice out there on remediation and handling these buildings when they do have a problem that can make people sicker and sicker, or a lot of times the remediation is not successful and people continue to be exposed. I think we need more practitioners who are aware of this and have this on the radar as well. It's important that as practitioners, we don't have mold goggles on. That's not the takeaway message. We don't want to just focus on mold, but I think we need to zoom out a little, have mold kind of on our radar as something that could be a huge part of the puzzle for these patients, but also recognize that there are many other things that influence our health. And we need to be working from a preventative level on helping reduce some of these risks, essentially the risk factors. In order to address this when it's going on in terms of working with somebody who's a long hauler patient or somebody who is sick from mold or both, I think we need to look at those root issues, what we talked about and kind of outlined in several slides of those internal health stressors, the external health stressors, looking at nutrition, looking at the structural piece, the orthopedic side of things, nervous system dysregulation, of course, addressing detoxification. All of these are so important to have on our radar when working with these patients. And if we aren't trained in all of these areas, it's really important to refer out to people who are and to come up with a referral network in your local community, people you trust who can help these patients heal and help these patients thrive again. The good news is there is reason to have hope. And I have seen long haulers completely reverse symptoms 100% and go back to, I would argue, a state of better health than before they got COVID. So it is possible with the right approach and with patience and with some trial and error as well. I also see full reversal of symptoms with people who have been sick from mold. It's a slow process, but it is possible to reverse those symptoms and to restore health, and again, to return to work, return to function, return to sport, etc. So while this topic is a little bit daunting and a little bit overwhelming, I think that it's a powerful one. And when it's gone about the right way, it can really empower people and help them heal for the long run. Here are some of the studies that I looked at as I was kind of breaking apart some of that research. So you can kind of take a picture of this and check out some of these studies. I thought they were very interesting. If you're interested in learning a little bit more about mast cell activation syndrome and or dysautonomia and or the hypermobile type of EDS, I have a couple of books out. This one on the left was written in 2019 and the one on the right was published in 2021. So I will give you the warning that they are a bit long, they're a bit lengthy, but hopefully they're helpful and provide more information about these conditions. Love to connect with you if you want to ever collaborate or expand on anything we talked about today or anything in the kind of holistic functional wellness realm. I would love to connect, so feel free to reach out with any of these methods on this slide. Thank you so much for being here. Thank you so much for your attention. I hope you learned something from this presentation. It's really hard to do mold justice in a short 30-minute presentation, but I hope that this was a nice way for you to learn a little bit more about the topic. And my hope is that we can really spread a message of hope to these patients. My hope is that we can spread awareness to the general community about how important it is to have mold and these other functional medicine root issues on the radar with patients who have long haulers issues. And I hope that one day we will really reach a good place of prevention with all of this. Thank you again for your time.